How to prevent and manage colds and flu with diabetes, back to naturediabetic.com. The only good thing that came out of the pandemic for me was that I haven't had a cold for years. Wearing a mask, social distancing, and frequent hand washings kept me from catching a cold. Of course, no one enjoys being sick, but the cold and flu are worse for diabetics. This is due to our immune system, which makes it harder to fight infections. In addition to these three things, there are other remedies and tips that can help you prevent and manage colds and flu. Undoubtedly, the best remedy is prevention. Get the flu shot. According to the National Foundation for Infectious Diseases, people with diabetes are 3 times more likely to die and 6 times more likely to be hospitalized because of flu-related complications, compared to people without diabetes. Contrary to popular belief, the flu shot won't prevent a cold, but there are things you can do to protect yourself. For example, wash your hands and avoid touching your nose, mouth, and eyes. Most importantly, plan for sick days. If you can't hold down solids, eat soft foods like soup, gelatin, juice, pudding, popsicles, soda, and applesauce. Have painkillers and cold medicine stocked. There are sugar-free ones such as Diabetic Tussin, sugar-free Ricola and Halls throat drops, and sugar-free coldies. Discuss adjusting your insulin or diabetic medication with your doctor. Contact your doctor if you have ketones, uncontrollable blood sugar levels, severe chest pain, vomiting, diarrhea, fever, difficulty breathing. Having diabetes can weaken our immune system, which makes it harder to fight infections. Infections increase hormones, such as cortisol and adrenaline. As a result, our blood sugar levels go up. For this reason, it's important to test blood sugar levels and ketones frequently. Cold and flu remedies found in nature. There are 2 popular natural remedies used to manage the cold and flu, but you must use them with caution. The first one is echinacea, also known as purple coneflower. Studies have shown that echinacea may fight infections and viruses, lower the risk of catching a cold by 58%, and reduce the duration of colds by 1.4 days. However, other studies did not see results for preventing or lessening colds. Keep these studies in mind and be aware that there may be adverse effects. The most common side effects are digestive, including stomach pain, diarrhea, and heartburn. People who are allergic to ragweed, mums, marigolds, or daisies may be allergic to echinacea. According to WebMD, take caution using it if you have an autoimmune disease such as MS or RA, since the plant may make these conditions worse. The second plant used for colds and flu is elderberry, also known as sambucus. Many trials have shown elderberry relieves and reduces the symptoms and duration of colds and flu. However, take caution not to eat the berries. They can be toxic and cause diarrhea, vomiting, and nausea. Cook the berries before consuming or buy the supplements and syrup. Also, like echinacea, take caution if you have an autoimmune disease, since it may cause the immune system to become more active. If you want to try either plant, please check with your doctor first. Also, use a product certified by a third-party tester. Without a doubt, more research is necessary. Of course, you can't always prevent the cold and flu. But you can try the following remedies and tips to ease symptoms and prevent infecting others. Apply vapor rub on chest and feet, cover with socks. Suck on zinc lozenges. Apply Zicam cold remedy nose swabs inside your nose. Take vitamin C. Hydrate with chicken soup, water, and electrolytes. Wear a mask. Wash hands regularly or use hand sanitizer or baby wipes. Eat oregano and garlic, which are antimicrobial. Use a humidifier. Take warm baths. You can use vapor bath wash or eucalyptus bath bombs. Use saline nasal spray. Gargle with salt water. Wash utensils in the dishwasher or use disposable ones. Do not share toothbrushes. Disinfect toothbrushes with antibacterial mouthwash or hydrogen peroxide. Wash sheets, pillowcases, towels, stuffed animals, etc. Wipe down surfaces such as counters, doorknobs, faucets, remote controls, etc. Rest. Avoid not sleeping enough, smoking, and drinking alcohol, which may make symptoms worse. Also, medicines containing decongestants can raise blood sugar and blood pressure. You can try cold medicines for people with high blood pressure. As an alternative, here is a natural recipe that suits a sore throat, congestion, and cough. Combine all ingredients in a cup. Hot water, honey, lemon, cayenne pepper. The cold and flu are worse for people with diabetes because our immune system makes it harder to manage. Also, infections will increase our blood sugar levels, which is also hard to manage. Prevention and early treatment are important. Before you try any of these remedies, please check with your healthcare provider. You should also discuss treatments for managing high blood sugar levels. And have a sick day plan. Please remember, this is not medical advice or intended to replace the advice of your doctor. This is my experience with the natural supplements that have helped me manage my diabetes. They are not intended to cure any disease. Please do not self-diagnose. Always check with your healthcare provider before trying new treatments. Also, natural does not mean safe. Many natural remedies have side effects and can interact with medication and supplements. It should be noted that the FDA does not regulate dietary supplements but treats them like foods and not medication. Unlike drug manufacturers, supplement makers do not have to show their products are safe or effective. I ask you to please keep an open mind, be a diabetic detective and do your own research, work with your healthcare team, see what works best for you, and monitor your blood sugars.